Hi, I'm Dr. Matheson Harris in Salt Lake City, Utah. Our tears are extremely important to the health of our eyes. Without enough tears, our eyes are uncomfortable and vision suffers. Sometimes, though, we have too many tears and our eyes are wet and blurry. The most common reason for teary eyes is actually dry eye. When eyes are dry, a reflex causes the tear gland to pump out lots of watery tears to wet the eye. See our page on dry eye for more information on that topic. Sometimes the problem resides in the drainage system of the eye. Each time we blink, our tears are spread across our eyes and then pushed toward the inside corner where they drain into a series of tubes. These tubes carry the tears to our nose where they go down the back of our throats and are swallowed. When the tears can't get through this system, they pool on the eyelids and run down your face. As an oculoplastic surgeon, I specialize in treating these types of problems. In the office, we can perform an examination to localize the blockage and recommend a treatment. Sometimes the only treatment needed is to flush water through the system. Other times we place stents or do bypass surgery to make a new drainage pathway. The most common surgery we perform is called a dacryocysto-rhinostomy, or DCR. In this surgery, we create an alternate pathway for the tears to get into the nose, bypassing a blockage in the tear drainage duct. This is done with you completely asleep and involves making a small incision near the inner corner of the eyelid by the nose. Through this incision, an opening is made in the bone directly into the nasal passage, and the tissues are stitched together, creating a new tunnel through which the tears can easily pass. At the end of the surgery, we place a small tube to protect this new pathway, which will stay in place for a few months. The skin is closed with stitches and covered in ointment. The patient will go home the same day and use ointment 3 times a day, as well as eye drops to prevent scarring from closing off the new tear drain. At home, you'll just need to avoid strenuous activity for 1 week. You shouldn't blow your nose for 1 week either, as this can force air into the skin of the eyelids. Bruises take around 2 weeks to resolve. We'll remove your stitches around 10 days after surgery, and the stent will be removed 6 weeks later. Complications are rare, but can include bleeding after surgery, continued tearing after the stent is removed, and infection around the stitches. If you have any questions about tearing problems, call our office and set up a visit. Thanks for visiting Utah Eyelid and Facial Plastic Surgery. We look forward to helping you feel and look your best.